Hello, my name is Courtney Charles, and today I'm going to be talking about some different approaches in treatment for sexual trauma victims. Sexual trauma refers to the distress that results from one or maybe multiple violations of a sexual manner. This often can have very life-altering impacts on mental health, and recovery from this is wholly unique and should be individualized to each person. Therefore, so should their treatment. That's why I think it's so important to look at these different approaches and think about what would suit each individual. This is something that is extremely prevalent in our society and requires our attention and our thought. 81% of women and 43% of men have reported having some sort of sexual harassment and or assault experience. Approximately 40% of these victims will go on to develop post-traumatic stress disorder, which is why, as you'll see, there's a lot of focus on treating PTSD. 75% or more of children and adolescents have experienced some form of sexual trauma by the age of 18 as well. So that's another domain that really requires our thought. A quick overview of what I'm going to be talking about. I'm going to go over some cognitive behavioral therapy techniques. I'm going to go over eye movement desensitization and reprocessing, which takes a bit of a more physical approach to healing, as well as yoga, which once again takes more of that physical approach. Cognitive behavioral therapy as a whole focuses on recognizing and altering misguided thought processes or dysfunctional thought processes, and in the end, hoping to see behavioral change as a result. Some techniques that you're going to see in order to do this are things like reframing. That can be in terms of verbiage being used or altering the way you think about an event. In this case, it would be that trauma event. You're going to see a lot of imaginal reliving in this case as well, which is talking through the event and going back to that moment. Imaginal exposure, which is exposure therapy, but more of a oftentimes digital format. So things like videos, virtual reality, pictures, that sort of situation instead of going and living in the event again, which is something that you would do instead with in vivo gradual exposure, which is living in that exposure event. You're also going to see a lot of stress reduction techniques. So things like mindfulness, things like the grounding techniques, such as 5, 4, 3, 2, 1 technique, working on coping strategies, so going for a walk when you're in that moment of high stress, those sorts of things are all in order to assist in recognizing that thought process, altering it, replacing it, and then seeing that change in behavior. Now that we have kind of a broader view of what CBT is as a practice, as I mentioned before, adolescents and young children are a large portion of these victims and deserve a lot of attention as well. So, trauma-focused CBT is tailored towards younger individuals, and it takes into account the role of the caregiver in treatment, developing nature of the child's emotion regulation and coping capabilities. This is because children are going to process things differently than an adult would, and they're going to need some different techniques throughout their treatment journey. Some of that's going to look like involving caregivers in therapy sessions, teaching safety skills to increase that feeling of safety and decrease feelings of helplessness, psychoeducation on why they are feeling this way, meaning looking at normative responses to trauma so that they know they're not alone, behavior modeling, as well as previously mentioned CBT techniques as well. Those are going to still be part of this treatment. Another domain of cognitive behavioral therapy that I think is relevant here is cognitive processing therapy. This focuses more on PTSD specifically and recognizing what they call stuck points. Stuck points are the moments, the memories that you can't quite process correctly, and therefore you're having this distress from. Some techniques that you're going to see in this form of CBT are, again, working a lot on recognizing those stuck points, talking through that. Psychoeducation, once again. You're going to see them have patients write impact statements a lot of times on how they've been affected, as well as, once again, those previously mentioned CBT techniques, because this still does fall under the domain. A difference here is that it's typically offered in a 12-session format, so it's a little bit more restricted. Overall, CBT is often regarded as the most effective method of treatment for sexual trauma. However, this is debated, and there's been a lot of new research that sort of goes against this, but it is still seen as the first line of defense in majority of literature, and it's extremely well supported. One meta-analysis on CBT found a reduction in post-trauma related struggles, including significant decreases in PTSD, anxiety, and sexual concerns, as well as anger. In one study, 4 out of 5 participants actually no longer met the criteria for PTSD by the end of their treatment sessions. Meta-analysis on trauma-focused CBT found a decrease in post-trauma related struggles such as anxiety and depression once again, as well as conduct problems in school and at home, and an increase in prosocial behaviors in social settings. CBT was found to lower the severity of PTSD symptoms throughout post-treatment at many different points that they measured, as well as anxiety and depression scores. So all this to say it's very well supported, and it's often seen as the first line of defense in this treatment. Next, I'm going to be discussing eye movement desensitization and reprocessing. EDMR focuses on the reprocessing of a traumatic event through visualization of said event alongside bilateral physical stimuli. This specific treatment works through 8 processing stages. So the first stage is going to be history taking, which is when they're going to work through talking about that event and figuring out what needs to be targeted. Then there's preparation for the individual so that they're aware of what will be occurring. Then they're going to assess the components of the memory. And then after that, you go into the desensitization, which is going to be that bilateral visual stimuli while talking through the event. Installation then comes after that, which is the addition of a positive cognition. Then you're going to have a moment of body scan to assess your stress response in the body, and then closure at the end of each session, as well as reevaluation at the start of every session. With EDMR, one study actually found that PTSD symptoms decreased anywhere from 84 to 100% following treatment. And then there was another study that found 100% of single trauma victims and 77% of multiple trauma victims no longer even met the criteria for PTSD after an average of 6 50-minute sessions. The last technique I'm going to be talking through here is trauma-sensitive yoga. Trauma-sensitive yoga is yoga with a focus on increasing safety and working on increasing internal bodily awareness and mindfulness. So within this therapy, you're going to see an emphasis on safety, an emphasis on choice, and hopefully an increased tolerance for physical stimuli as they go along this treatment process. So those sorts of things are meant to help regain that autonomy. However, this form of treatment is highly recommended, but typically is recommended to be used alongside another form of treatment, such as CBT or EMDR. It's not meant to be a only individual treatment on its own. When used correctly, one study found that 52% of yoga intervention participants no longer met the PTSD criteria. There were also lower levels of relapse compared to treatment as usual, and increased proprioceptive awareness as a result of this treatment course. When considering these different treatments, there are other components that I think are notable to discuss as well, which is early intervention versus treatment as usual. What I mean by this is there's been an increase in literature recently that looks at whether starting treatment within the first 6 weeks after the traumatic event versus after that point, if that makes a difference and if it increases the efficiency and efficacy of said treatment. And there have been some mixed results based on the studies I've been able to review. So I think that's something that I would like to know more about. And that's something that I think would be a great area to continue studying and looking at. Another one is online format efficacy, which is something that the previously mentioned study actually looked at, and they found for CBT specifically, at least, that the online format was just as effective in their review. And that's a way I believe that we could increase access to treatment. So I think it's important to note that. Another area is barriers in reporting. That's one of the biggest issues as well with early intervention is only so few are actually reported of these incidents. So it's hard to get people into treatment. I think that's something as a societal issue that needs to be addressed is changing the narrative around sexual trauma so that people feel safer and more willing to get the help that they deserve and be able to heal and function again as a person that they would like to be. Overall, the prevalence of sexual trauma being established as so important is it's crucial that we continue to investigate the efficacy of treatment options and that we work to provide each individual with the best chance of recovering. There are barriers and components of treatment that I think still need to be further researched and looked into in order to increase access for all these individuals. And I hope that this is something we can all take into consideration. And then these are my references. Thank you so much.